Hi, I'm Amy McCarter. Welcome to House Calls brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about epistaxis. Thank you for being here today.
Thank you for having me.
What exactly is epistaxis?
Epistaxis is the medical term for the common nosebleed. It's a common problem we see both in children and adults, and typically is a self-limiting illness. Fortunately, only about 10% of people that have nosebleeds need to present to their physician for treatment.
And what are the symptoms?
People with epistaxis will present with either anterior or posterior nasal bleeding. The bleeding site typically for about 90% of people is from the anterior portion of the nose, and therefore the blood is coming from the front part of the nose. People can present after an upper respiratory illness or some sort of local trauma to the nose, which will then subsequently cause the epistaxis.
How do you evaluate it?
Evaluation is fairly simple. We first want to identify exactly where the bleeding is coming from. Again, for 90% of people, this comes from the vascular plexus at the front of the nose. We can use anterior rhinoscopy, or just shining a bright light in the nose, or we can use an endoscope to further evaluate the nasal cavity and determine the location of bleeding. Once we've been able to determine the location of bleeding, we can either apply a local medication to this, or perform chemical cautery or electrocautery, or sometimes nasal packing to help stop the epistaxis.
And is that how it's usually treated?
Typically, we would rather treat this with cautery because it's easier for the patient and much more comfortable.
Is there ever a point that the patient should call the doctor about this?
Anyone exhibiting symptoms of a nosebleed that's occurring more than once per week, or if they last longer than 15 or 20 minutes, should present to see us.
Okay, good information, thank you. Please join us next week for a new health topic discussion on House Calls.